Researchers at Sinai Health and the University of Toronto have conducted a study challenging the idea that an insulin surge after meals is inherently bad. The research, led by Ravi Ratnakaran at the Lunenfeld-Tannenbaum Research Institute, explored the long-term impact of insulin levels after meals on cardiometabolic health. The study followed new mothers, examining over 300 participants recruited during pregnancy between 2003 and 2014. The researchers found that a robust post-challenge insulin secretory response, once adjusted for glucose levels, is associated with beneficial metabolic effects and predicts favorable metabolic function in the years to come.
If you enjoyed this video, please give it a thumbs up and subscribe to my channel for more great content.